And also, interestingly, you spoke about sweet pills. So it goes contrary to the maxim that no pain, no gain. So here there is gain even without pain. So tell us about how homeopathy is different from other forms of medicine, such as allopathy.
So we spoke about infections, and then we've also spoken about how homeopathy totally cures chronic diseases. So first of all, let us understand what a disease is. In simple terms, when you read the word disease, Disease, disease. So it is a combination of two words, dis and ease. So the opposite of disease is ease. When a patient is at ease, what it means? He is healthy, both from mind and from body. So if a patient is having some condition, pathological condition in his body, he is suffering from a disease. And if he is having some disorder in his mind, it also means that he is suffering from a disease. Okay, and very importantly, we consider both the mind and the body. Now if a patient should be at ease, he should not suffer from his body nor from his mind. That is what is homeopathy, we believe. And that is the reason we consider both the mind symptoms and the body symptoms. Now in English medicine, for example, if a patient is suffering from diabetes, there are 500 people who are suffering from diabetes, and they are taking treatment from one XYZ doctor. The mode of treatment is same, how the treatment has to go is same, everything is same for every patient. For example, they start with metformin, and all the 500 patients are given metformin. But in homeopathy it is not like that. And more importantly, what happens in allopathy? For example, a person is suffering from a liver disease, the doctor will only consider the symptoms and the signs and the investigations, only limited to the liver. He will not consider the other parts of the body. And every patient is hardly given 5 minutes or 10 minutes of time to diagnose. But what homeopathy here does is, now we took the example of diabetes. If I have 500 patients who are suffering from diabetes, the medicine given to each patient might be different. There are more than 1,000 medicines only for diabetes in homeopathy, and it changes from person to person. Now, how it changes from person to person? When the patient comes to us, we do not separate the body into spare parts like liver, kidney, heart, pancreas. We do not separate. We consider the patient as a whole. What we do is we consider the patient as a whole. And what we do is we start taking the case. And the process of case taking itself might range between 15 minutes to 2 hours to get the exact remedy which will treat the disease of the patient. So there are a few principles. Now what we do, we take the case in detail. We consider the patient from head to toe. We write down what all problems the patient has. After taking the case in the physical sphere, we go to the mental sphere with what problems the patient is suffering on the mental side. And then we look at the constitution of the patient, how the patient is lean, thin, tall, fat, dark, like that.
The
And
physical
then
attributes.
physical attributes. And then we have a look into the temperament of the patient. All this, it takes around half an hour, 45 minutes, 1 hour sometimes. And then we advise the investigations that are required for the patient. And then we prescribe. So for each patient, we take time to delve into the nature of the patient. We consider the disease of the patient, and then we also take into consideration how is his sleep, how is his appetite, what does he like eating, what does he dislike, whether he is comfortable in hot weather, cold weather, whether he feels very thirsty, does he have more amount of water or less amount of water, how are the symptoms of the patient. For example, if he is coming with a knee joint pain problem, are the symptoms aggravating in the morning or in the night, during sleep, in the winter, after passing stool? So there are multiple things that we consider. whereas other systems do not. And then after taking the case come the principles of homeopathy. So what is the basic principle of homeopathy? So what is the basic principle of homeopathy? As I've told in the beginning, that we treat the patient holistically. More importantly, we treat the patient and not the disease. So that is also a very important principle of homeopathy. And the system of administration of medicine, what we do is we have a principle called similia similibus curantur. So what does this mean is, let the like be cured by the likes. That is, a drug which produces symptoms in a healthy human being, those symptoms, if present in a patient who is suffering from a disease, will cure that patient. That is what we believe. So we have a process of drug proving. And then after proving the drugs, they've been proved for more than 200 years. We have a book called Materia Medica, which has a detailed description of the symptoms of each and every drug. We have more than 500 drugs, and we administer that particular remedy which best suits the patient, and that helps in curing the disease. Now some people have a question that how can a drug which has disease producing symptoms in a healthy human being cure a patient who is suffering from similar kind of symptoms? That is what arises in people's mind. But see, even in modern medicine, for example, now when COVID was there, everybody had taken vaccines. And what do vaccines do? Now, for example, we have an Indian vaccine also, co-vaccine. So vaccines will have either the dead virus or live attenuated virus, a weaker virus than the regular infection, or a dead virus which might produce symptoms. You might have heard children who take vaccines suffer from fever, cold, cough, headache for 2 or 3 days, mild fever, cough, cold fever. Vaccine is given when the patient is healthy and the patient develops those symptoms. And in the same way, we have drugs which will produce symptoms, and they are given to the patient who is suffering with the disease, and then the disease is cured with these medicines. And this has been going on for hundreds of years. So that is how we are different from allopathy.
So you spoke about healing the mind and the body of the patient, which is psychosomatic, if I am not wrong.
Psychosomatic, such terms like psychosomatic have originated recently.
Okay.
And now allopathic medicine, modern medicine are also giving importance to mental health.
Right.
They are also accepting that when mind is disturbed, the body is affected. That is stress. There are etiological factors for a disease in textbook of medicine. And in each and every chronic disease, if you go through the etiological factors, that is, things which might cause the disease, stress is present in more than 90% of the diseases. Or sometimes they also write it as idiopathic cause, where there is no perfect cause for the patient to suffer from so and so disease. But we have been doing it for 200 years. You can call it psychosomatic. What we believe, every disease is psychosomatic. We've given names for diseases in today's world, but this has been done 200 years back by our founder. That symptoms are there in the mind, symptoms are there in the body. We need to correlate everything, talk to the patient, be humane towards the patient, and then prescribe the medicine. So yes, psychosomatic,
Is the right.
you can correlate it.
Okay.